Danielle and John Bellerose versus Beth Israel Deaconess Medical Center, case number 2006-02412. Judge Paul E. Troy presiding, Suffolk County Superior Court, Massachusetts. This is a wrongful death action on behalf of a premature 8-day-old twin who was diagnosed with necrotizing enterocolitis. The baby's parents alleged that the ones caring for her in the NICU failed to recognize that their daughter's health was deteriorating, and then took too long to call surgeons after her bowels had become perforated. She died 1 day after diagnosis. 2 doctors, 2 nurse practitioners, and 2 nurses were accused of medical negligence.
I now call Danielle Bellerose to the stand for questioning. Do you swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I swear.
Tell the events that took place on June 20th when you arrived at the hospital.
I arrived at the hospital on June 20th to visit my daughters and found Catherine looking discolored and unresponsive, with the hospital monitors showing problems with her heart rate and oxygen levels. She appeared mottled and gray. I panicked and demanded testing. It took more than an hour for the staff to help my family and 4 more hours to call a surgeon.
Do you feel they were paying close and careful attention to your daughter?
Well, as a nurse, I did not feel they were paying close or careful attention for any signs or symptoms of necrotizing enterocolitis, but signs and symptoms were present, including increasing distension of the abdomen and increased respiratory rate. However, the hospital claimed these were all non-specific findings and specifically denied that there were any signs or symptoms of this. She was at risk of developing this because she had an immature bowel due to prematurity. She was receiving Indocin for a patent ductus arteriosus, and she was being fed an increased amount of enteral feedings via NG tube, which also increased her risk.
What findings did they present you with after her testing was completed?
She had blood work done and an x-ray. Catherine was found to be in profound shock due to her necrotizing enterocolitis. Her blood was acidic, and an x-ray indicated there was a tear in her bowel. Just after midnight, she was transported to Children's Hospital Boston. Surgeons made a last-ditch effort to save her life by removing her colon in the hope that this would halt further damage. She failed to improve, and multiple rounds of CPR were performed. On 5:22 a.m. on January 21st, 2004, she was declared dead.
I have no further questions. On September 2nd, 2011, after finding that Catherine Bellerose's death was a direct result of deviations for the accepted standards of care, the lawsuit that began in 2006 against 6 of the doctors and nurses who had treated Catherine was decided. The jurors found Dr. Janet Lloyd and Michelle Ambrosino, nurse practitioner, guilty and negligent in her care. The case took 2.5 weeks to try, and the jury deliberated for 7.5 hours over 2 days. The parents were awarded $3.5 million each for the loss of mother-daughter and father-daughter bonding, and $50,000 for the infant's conscious pain and suffering.